Welcome to the Chinese Medicine Podcast with your host, Marie Hopkinson, Chinese medicine practitioner. Hi, welcome back to the Chinese Medicine Podcast. I'm Marie Hopkinson. I'm a Chinese medicine practitioner, and today I'm joined by another Chinese medicine practitioner, Dr Andrew Orr, and we're in beautiful, sweaty, humid Queensland. And we're going to be talking about fertility and particularly his special interest of endometriosis. Now, Andrew's got extensive study in women's health, and he firstly started doing his Tcm studies or Chinese medicine studies, and then he's gone on and done several research-based degrees in Western medicine fields of fertility or women's health.
Women's health, reproductive medicine, women's health medicine, and so I've combined the medical and the complementary medicines together and give people that multimodality, integrative approach now.
Yeah, great. And in your practice, you practice herbs and acupuncture together?
Yeah, I do herbs and acupuncture as well, and mix in, nutraceuticals, and I've got my own Chinese herbal medicine company and nutritional medicine company as well. So I use a lot of mix it up and use what works, and what doesn't work we throw away, and mix a bit of everything together.
Yeah. So Andrew's just probably every year of your life you've probably been doing a degree, it sounds like, because he's got so many degrees. And he's also studied nutritional medicine, like naturopathy-based nutrition, right? As well as Chinese medicine.
Yeah.
So it's a privilege to have him talk today about endometriosis. That's the main topic we're going to be discussing today. So welcome to the podcast, welcome to the channel.
Thank you so much, it's great to be here.
Yeah, awesome. Okay, so let's just talk about that. So also this month it's going to be National Endometriosis Month, or Endometriosis Awareness
Month. So every March it's what we call Endo March, and it's to bring awareness for endometriosis, because 1 in 10 women are being diagnosed with endometriosis, and there's not enough research and education out there about it, and we've got to get more. Yeah, right. Okay. So what's the most
I guess maybe not the most important, but what do you feel is one of the most important things about the awareness? Why do we need to get that awareness?
Because a lot of women believe that things like period pain is normal, and it's not. And we're brought up to, I suppose, a lot of women. The hard part about it is that most women with endometriosis, it takes up to 10 years to diagnose.
Yep.
They say they've got it down to about 7, but even at 7 years, that's too much. But there are some women that are 20 years before they're diagnosed, and that's a lot of women being missed and dismissed, as I say, along the way. So we've got to start educating people.
Yeah. And I think also maybe because it depends, it is education, and that comes back to family education. So a lot of girls get their education from their mum, and if their mum didn't have that, was told that was normal and that was just grin and bear it sort of thing, it'll go away, or
Yeah, and that's what happened. And then the worst part of it is now we have, people go to their GP and the same thing. It's grin and bear it, suck it up. That's just a woman's thing, and it's not. There's clear-cut symptoms for endometriosis, and there's not enough referring on. And at the same time, even in the specialist area, there's not a lot of people that specialise in it. So even a lot of specialists are missing it.
Yeah.
It's a big thing. So that's my main education, to say this is who you see, this is where you go.
Yep.
Access the right surgeons, access Chinese medicine, do that multimodality approach, and hit it from every angle.
Yeah, right. Okay. And so what would be the symptoms that people might need to look out for that would be just, I guess, the difference between endometriosis and just standard period pain, let's say?
Yeah, well, I suppose there's a difference. We say that there's an element of pain for women. Not pain. I say, look, a period could have discomfort, but there's a difference between discomfort and pain. Now, if you're on the floor or taking, 10 naprogesics or Panadol, and you've got to get through every period, or worse still, you've got all the bloating and all the symptoms of that with it, we want people to know that that's not normal. So, pain with intercourse, they get chronic fatigue, IBS symptoms with women.
Okay.
It's a big pointer to endometriosis, and then bladder issues, pain on bowel movement, abnormal uterine bleeding. And the other part we want to try and educate women on is that endometriosis just isn't period pain. it's all the other related symptoms. So some people don't get the period pain, so a significant portion of women with endo actually are asymptomatic. They don't have any symptoms, so we only find them accidentally with fertility evaluation.
Okay, right. And aside from fertility, like let's say a person didn't want to have a baby or they never went down that road, why would they need to be concerned about other detrimental things that could happen to them if they didn't get it treated or didn't get it sorted?
I've just been doing a series of posts on that about the actual serious complications that can happen. And the serious part is, we could have a compacted bowel, a bowel, could actually rupture. Right. It can actually spread to every organ in the body. So we know some women have got diaphragmatic endometriosis, pericardial endometriosis, it can get into the brain.
Yep.
But the worst part of it is it can cause a lot of adhesions and adhere other organs together. So then, next minute we know a bowel rupture, the bladder's failing, renal function failure. But the other part is the emotional aspect of women trying to manage these things on their own, and they're at home and their anxiety, and next minute we know we've got a woman suiciding.
Okay.
So, and that's what's happening.
Yeah, so it could be anything from physical, all these other physical problems, to severe mental health, and even suicidal, those kind of issues, right? Yeah, maybe being in a place of complete despair and just not knowing what the problem is, right?
That's right, and being told that go home and suck it up, and not being able to access the right people and things, and thinking that I've had surgery and that's the only model. So it's about teaching people that it is that team approach. You've got to get out there and seek other healthcare professionals as well.
Right. Okay. Yep. And just so that people, maybe they're not sure what endometriosis is, because you're talking about, it affecting your lungs or different areas. It's the endometrial tissue that should be in the uterus, going to other places in the body and setting up camp like that, and basically acting as if a uterus should be there and it's not, right?
That's basically one way to explain it. I say to people that endometriosis is normal tissue, just growing in a normal area. So when it expresses, it bleeds like you're having a period, but in multiple locations. And the best way I explain endometriosis is like the C word, the cancer word. It very much behaves like cancer, because it can spread. It doesn't cause cancer symptoms, although there is some research to show that women with it are more prone to more things like endometrial cancers and stuff. But yes, it can spread and then it causes those resulting inflammation, adhesions and things like that. So it's they've found it in every organ in the body, as I said, and they've found it in joints, and they've had people with sores in their fingers that just won't heal, and then they're biopsied and it's endometriosis.
Right. Okay.
So it's a bit of a worry.
Yeah. Right. And I think it's probably the first thing that, like you said before, is awareness. And so by talking about it and doing things like this, it's good for people to be aware that, hey, your symptoms might not be just, hey, you just have to grin and bear it, or live on painkillers, or be anxious for no reason, right?
That's right, and we know despite the best medical interventions that women are still in pain, so they need to access other areas too, and that's what I'm saying now is this multimodality. They're going to need to see a pelvic floor physio, they'll need to see a counsellor, go and see a Chinese medicine practitioner, or see someone that can help them with some complementary medicines and things. And then all work in as a team together. So that's part of what I'm doing at the moment, is setting up a program to bring complementary medicine and Western medicine and all that together to have a referral system.
Yeah, that's great. Okay, good. Because I think some people go to their GP. The GP might send them to the OBGYN, who deals with everything from any women's health problems at all. I mean, I remember once going to an obstetrician once for period pain, and he told me the uterus is meant to be functional. You should have a baby. And that would solve my problems. And I'm like, I don't want to have a baby. That's not going to solve my problems. And that was it. You were just sent off like, okay, well, I've done your consult, and then you're like, well, what else now? What do I do now?
And that's the big issue, is that teaching women that not every OBGYN can deal with endometriosis. You've got to see what we call an advanced trained excision surgeon who specialises in advanced trained laparoscopy. And because your normal OBGYN, they can do a laparoscopy, but doing one and doing one well is two totally. So these advanced trained guys have 5 years more experience and they have to do a certain amount of surgeries per year, and you have to excise the disease. But the good point that you just brought up then, there's a lot of myths.
Okay.
The facts are that, pregnancy doesn't cure endometriosis. There's no cure for endometriosis. Teenagers aren't too young. We've found endometriosis in young girls as young as 5, accidentally thinking they've got appendix, and they've found things like that. Pain levels aren't related to the extent of the disease. So we see some women that only have very mild endometriosis, but they have all the symptoms. And then you can see someone that's riddled with it. I mean, their pelvis is obliterated, and they'll have no symptoms at all.
Okay.
And that's the hard bit. But pregnancy doesn't cure it. Scans can't find it. The only way to definitively diagnose endometriosis is with a laparoscopy, and they do a biopsy histology at the time.
Yeah. Okay. So that's like a surgical procedure, right? And that maybe that's also why some doctors are a bit reluctant to just go straight there, and that's why it takes so long to diagnose, because you sent here, try painkillers, try the pill, try this, try that, and hopefully some of those things work before you need to go. And all the meanwhile, the endometriosis it's not resolved and it's getting worse.
And that's the hard bit, because a lot of women are sent away. The GP will keep them too long too. This is why they're not diagnosed for up to 10 years.
Right.
And there needs to be education from the ground level up, early referral, early intervention, because we know the sooner that it's intervened with, the better, before it spreads.
Yeah, okay.
But we also know it's driven by estrogen. So if a woman's put on an estrogen-containing pill, sure, it's masking it, but it's also aiding in the growth. So they need a progesterone-only pill if they're going to go on those medical interventions. But there's a point where it comes to that everything else is not working, then surgical intervention is needed. And then you work on it after that with a multi-modality approach, using things like herbal medicines and, medical interventions together, and then try and suppress the disease from growing back out again. But we know, because there is no cure, it will grow back, but if we can suppress it and make a woman asymptomatic, that's all we want to do. Right.
Okay. Yeah. Cool. So wow, that's it's really good that people know that process and those myths. So thanks for telling us that and dispelling some of that. What do you think about the complementary medicine side of things, with all your knowledge and all your knowledge about different, like you mentioned, even things like pelvic floor physio and things like that? What kind of things could people expect, or look like, if let's say they don't have the benefit of being in Queensland and coming into your centre? Who should they see? Like, how should they go about this to get help?
There's a couple of reasons. I think now what's good is we've got telehealth now, so I do a lot of online consults for women in rural areas and that, and awesome. I can actually help them access, if I can't do the actual helping, at least I can be like their guide and say, you need to go here, and use people within my network.
Awesome.
But then I'll reach out to other practitioners and go, well, there's someone in Adelaide, or, there's Marie in Perth, or, and access those people as well, and make sure they see the people that actually know about endometriosis.
Right. So you help to coordinate people from all over the place, and you can do those consults and help set people up on the right path in that way. Okay, right.
Yeah.
And give them the individualised approach.
Yeah.
Right. Okay. And in your experience, what do you think the role of acupuncture can be to play in all this?
I think acupuncture and Chinese herbal medicine has been used traditionally for a long period of time. And while we have to be careful what we say, because it's all about research and things like that these days, with what we can and can't say. There is a lot of anecdotal evidence, like UNSW, where I did my medical degree with the masters, that they've done research on acupuncture, and they're just about to publish some papers on acupuncture. And we've known there's some good, credible research on pain. Or we know that acupuncture helps with pain, so you can help them in that.
Yep.
But also circulation. I say part of Chinese medicine is that it's called, basically from blood stagnation. So it's working on that microcirculation, working on pain receptors, and also helping women feel relaxed.
Yeah, okay.
And that can help. And then the herbal medicines as well. there's a lot of antispasmodics, you know, they work on the circulation and things like that. So I explain it in that level rather than so that people can understand that lay people, as you say.
So when you go to a Chinese medicine practitioner, or a person that does acupuncture or herbs, then they're going to check your pulse, they're going to look at your tongue, they're going to do an individualised diagnosis for you and work out, okay, let's approach it from this perspective, and they can use acupuncture. Definitely, I mean, we can say that acupuncture helps pain for sure, but there's lots of things it can do that patients might not come in directly for that, but like you said, those indirect things like, oh, they felt relaxed and that helped their anxiety, or it helped them sleep better, and then that might be the intermingling thing that helps their pain or something.
And that's right, and it's an overall explaining to them that if you balance the body out and you regulate the system, then everything else starts to work properly. And I think it's just talking in those terminologies so that people can understand it now. And I think we talked about this before. People want to hear, what does this do? And I think that's where practitioners can explain to people, well, this is how it works. And, you know, they might, you know, it's a little bit hard to understand, but we can explain it on a layperson's level. Yeah.
So one of the things you mentioned was, like, let's say a person's gone down the surgical road, they've had some of that endometrial tissue removed, or as much as possible that they could see, let's say, at that point. Is that a good place to then go and, okay, let's manage it with complementary therapy?
It is. It's a very good place. So I tell people, look, most of the time they will put some form of progesterone therapy in place, whether that's a Mirena or they're using a progesterone-only pill and then other medications. And this is where Chinese medicine can work and assist alongside medical interventions, and it's a great time to do it and get in there and try and suppress those endometriotic implants from regrowing and expressing out. And that's the hard bit, because I tell people it's like a weed. You pluck out your weed and the rains just happen like we had here, and then you'll come out next week and there's more.
Now they get there again.
And they get there again. And that's endometriosis. I say it's like, I've used the term, it's like rust. You know, you cut out rust and then more grows. But you can't see those micro implants, so it's really, really hard. But they are there ready to express again. And it's if you just use surgical intervention alone, it's not going to help it. And we have to start teaching women it's a team approach. You have to hit it from every angle.
Okay, all right. And what about the role of nutrition and diet? Does that help? Is that anything, can that help people?
It does. I think that a lot of people misunderstand diet. I'm sure diet alone isn't going to fix endometriosis. Look, there's no cure. If anything worked, it would cure it, right? But we know that women, when they adopt a low glycemic diet, which is low inflammatory, using things like probiotics, because we know that probiotic bacteria and the microbiome is a big part in inflammation. A lot of women with, most women with endometriosis will have some form of gut issues. So that's where things like Chinese medicine can help. We also know that probiotics, strain-specific probiotics target things. So we know like the 299B bacteria helps. Prebiotics, getting all that working. And then just, you know, everything we eat can cause inflammation. Like gluten is inflammatory. So it's taking all those inflammatory agents out.
Just like too much processed and packaging that acidic type of diet is inflammatory, right? Like in general.
That's right. So anything that causes inflammation, endometriosis is an inflammatory disease. So anything that causes inflammation, whether it's alcohol or sugar or preservatives, whatever, it's going to fuel and make it worse. So it's about teaching women how to work with their nutrition, work with their mental health. Like you really have to check in and see a counsellor as well.
All right. Yeah, good. And you mentioned the a physio that does the pelvic floor.
Yes.
What sort of role would they play in that injury?
Well, a lot of women would get what we call hypertonus in the pelvic floor. So they're getting pain with intercourse, they're getting pelvic and rectal pressure, and the nerves are too excited. You know, they're on, like we see with a lot of pain pathology. So it's about settling down. So a proper pelvic floor physio specialises just in the pelvic floor. So they'll get in there and actually work directly on the pelvic floor, like massaging. So say the uterus is just a muscle.
Yep.
So if you had a pain in your arm, you would massage it, wouldn't you? So that's what they do. It's a bit hard to get acupuncture at this, but we do know that...
We're not doing... Just so people know, we don't acupuncture.
No, we don't do that.
In there.
But there are distal points and things that we know and channels that run through the uterus, so you can use which we'll go through there. But pelvic floor physios work directly on the pelvic floor.
Right, okay. And so I guess that's, again, an individualised approach. They're going to know, they're going to look and diagnose you and work out exactly what you need and give you exercises and massage therapy to...
And not every physio does internal work. So you have to find the right, just like you have to find an advanced trained surgeon, advanced trained laparoscopic surgeon that specialises in excision. You have to find someone that is a pelvic floor physio.
Okay.
And what I say to women is you just can't find any old physio. You've got to find someone that has a special interest in it. Or you've got to find in the medical field, they have specialist fields, so you can see a specialist in that. And that's why you've got to see the advanced trained laparoscopic surgeons that specialise in the excision of endometriosis. When it comes to TCM and complementary medicines, you want to find someone that has a special interest in it, and that is something that is their primary focus. Because again, it's like a lot of people are generalists, they do a little bit of everything, so you want to see those people that maybe have that special interest in gynecological conditions and things like that. Because
when you go to TCM school, Chinese medicine school, you just learn a stock standard bit of everything.
Yes.
And most practitioners, not all, but most of them then go on and do further training in what they're interested in. And they might do further training in a Western medicine sense, like you've done further training forever. I don't think your further training's ever ended. Or you could do, for some people, really they follow another, like they might find another practitioner who's been doing gynecological stuff for a long time, and so that's just a conversation you need to have. Like, so when you go on their website or you're sort of ring them up, let's say, but most people are probably on the website or the Instagram or something, then have that conversation with the practitioner before you book in and say, have you got experience in treating this? Is this something that you're, because some practitioners will just say, all right, no, I don't take cases like that. I don't. And they'll usually have someone they could refer you to because they'll know who's in the industry.
I think that's really, really important. I think this has to go for both medical and complementary medicine. We've got general practitioners who are just a general, and it's not. I say to people when I talk to people about this, it's not having a go at general practitioners. They're not specialists. Their job is to identify something and refer you on. It's the same in complementary medicine. When you come out of college, you don't know unless you've gone and done further training. So again, have the conversation. Have you done further study? Do you have a special interest in that area? Have you done postgraduate training? And if they haven't, then ask them, do you know someone that has? And can you refer me? And that's what I do now, is try and access those people, and why I'm setting up these, what we call the experts program about, we're going to call it the endometriosis expert, PCOS experts, the fertility experts and the women's health experts. And it's going to be a referral base of people that really have a special interest in that area. And it'd be easier for people to access them.
Okay. So if you're a practitioner and you're watching this and you're thinking, I'm interested in knowing more about that, we'll put the links to Andrew's websites and stuff in the description for this video below, so you can contact him or just click on his website and get access, because you run a Facebook group for those people and things like that. That's what you're going to be doing.
And I do a lot of education online as it is on endometriosis. I think most people know me more for fertility, but mainly more for endometriosis and polycystic ovaries. But and adenomyosis, which is very close. It is basically endometriosis, but it's more confined just into the uterus. So that's what we're trying to. A lot of women will have adenomyosis and endometriosis together, and they might not know. And that's the big part of trying to get through to women, because we know some women are being told to have a hysterectomy for endometriosis. But a hysterectomy won't cure endometriosis. So a lot of the time they're having a healthy uterus taken out. But it can help with menstrual related symptoms, but not every woman has menstrual related symptoms with endo. But adeno is confined to the uterus. yes, a hysterectomy will help that. But, you know, those are those women that are just bleeding and there's nothing helping them, and they're anemic and got no life, and that can help them exponentially. But, you know, you try all the complementary, you can try all the conservative stuff first, and then if that's your last port of call, then that's the option that you might have to take.
Yeah, it's good that, I mean, it's good we have, people have access to lots of options.
They
in
do.
Australia and most Western countries, women have access to lots of options nowadays. And I guess maybe even like if you're a Gen Xer, like me, and your parents were baby boomers, that my parents didn't have the access to those options.
No,
one is because they didn't have the knowledge and they were just told to grin and bear it, and they just didn't know. And so it's not until you have a conversation, and it was also something that you just wouldn't talk about. It was probably a taboo subject, like you're not going to talk about your period pain or your discomfort. You're just kind of, you know, pushing on, and and so then that's led to that. So hopefully the next generation is going to have like be a lot more informed.
I think that's right.
Right.
With surgery previously, like our parents' generation, they would have had to have a big cut. You know, there wasn't laparoscopes, whereas now laparoscope is minimally invasive surgery. It's day surgery, and the recovery time's quite quick. Whereas before you had this cut, you know, this long. We don't have to worry about that now. So these routine laparoscopies are actually quite quick. But again, you have to see an advanced trained surgeon, and that's one thing I'm very big on, educating women about.
Yeah. All right. So if you're watching this and you're thinking you might have endometriosis, or maybe your partner or someone you know does have that, and you think they might, you know, not know where to go, the first protocol would be their GP, and then insisting that they could find an advanced trained surgeon. That's got that specialist in that area.
And that's what Endometriosis Month's about, is actually trying to train GPs and that now that to access, because not a lot of people know about this. So it's educating those people. Don't just send them to any OB/GYN. But even if you did, even a good OB/GYN should say, well, it's not really my field. I'll find you someone that can do that. But it's a big issue, and lucky now we've got the government throwing a little bit of money at it.
Well, that's good. To spread the awareness and help people. And I guess if you're in a rural area or something like that, then sometimes you have to just take a bit more control over your health, because you can't just take what's served up to you. Like, hey, this is the only doctor here, this is the only surgeon here, and so it's really great. You've got this integrative thing that people can access from all over. Do you take people from all over the world? Or
take people from all over the world, So, and rural's hard, having, you know, gone out the back in, you know, Adelaide, you know, in South Australia, some of those places.
Adelaide's almost a rural area.
Yeah, it is.
By itself.
But even some major cities like Adelaide and that often don't have a lot of, especially out in rural, but I mean even here in Queensland. So it is saying to people sometimes, like you just brought up a very good important point, don't sit there and think you have to live. Find somewhere. It might mean getting on a plane. I know it's really, really hard, but I say to people, staying locally, don't stay local if you haven't got the access, because if you get the wrong thing done, you will have to live with the results of that for the rest of your life.
Right.
So it'd be better to take a day or two out of your life, get the right thing done, and then it could help you for the rest of your life. Or if you stayed local, it could stay with you for the rest of your life too.
That's true,
It's a good point, being empowered. And one of the things I always say to people is that, you know, never be scared to get a second opinion. Sure, you've got to go through your history and things, and that's often why people don't seek a second opinion. But I say, look, seek a 10th opinion if you have to. And if you've got to explain that over and over again to get the right help, then it's worth doing, rather than living a life in misery. And
that's what I was thinking. So like with this kind of issue, I guess, like if people don't do something about it, like they're going to have their menstrual cycle. Let's say they have got pain and that's or they've got really heavy periods. Let's say it's not going to go away by itself. That's one thing. So if it's not, like, let's say you've gone to see a surgeon and they weren't the specialist surgeon, and then it's come back again or whatever, and you might have 10, 20 more years of your life like having to put up with pain or having to, you know, manage it in that way. It's worthwhile, like you said, getting on a plane, going to the right person, or, you know, spending that money and that time now, because you'll save yourself all this agony and discomfort in the future. Right?
And as I put up recently on posts, again, it wasn't to scare people, but the worst outcome is if you have a compacted bowel that then ruptures, or you have an endometrioma that goes systemic, that could kill you. Right. And a lot of women are sitting at home managing their pain with pain medications. And if you're still in pain and you're using pain medications, it means you aren't being managed properly. And it's about getting people to understand that you can't manage your own disease. You need a professional to help you. But long-term pain psychologically too, and this is where we're seeing now women that have, taken their own life because they've got to a point with high anxiety, depression, they're at home, they feel like no one listens. It's a big thing, but then we get some people too that are stuck in the past going, oh, well, the last person, all doctors are terrible and all people are terrible and no one's helped me. It's sad, but what I want those people to know is that while you haven't had that help, there is help out there. And you can't stay in the past either. You've got to move forward and go, right, there are people that can help me. And that's what I'm trying to do with people.
Yeah, that's great, Because I think there's a lot of women out there, just from talking to people, not talking to patients, talking to friends and family, that have had a bad experience and it's like they think that that's all medicine can give them. So they've gone, well, that medicine can't help me. All doctors can't help me because one doctor couldn't help me, and that's what they told them. And it's really sad that then they just kind of, sometimes the doctors have told them, like, here's a prescription for these painkillers, like, live on that, and that's your that's your lot in life type of thing. And it's something where I guess it's worth doing the investigation yourself. And I think even for Chinese medicine, like you mentioned, just like looking for someone who's had experience or the special interest in that. Like, you might have gone to an acupuncturist or a herbal practitioner or something like that, and there's so much diversity in our profession that just because you've seen one herbalist doesn't mean that the next herbalist can't help you. So it's worth, you don't just, because you've gone to Chinese medicine, you haven't been helped that one time, don't just write off Chinese medicine.
Yeah, it's like every profession. We've got good and bad in every profession, and that's one thing I say is that everybody's profession has got someone that's probably not so good at something. And if you end up seeing them, well, say you have a car and you took your car to a mechanic, and he didn't fix your car, you wouldn't keep going back, would you? It's the same with medicine or Chinese medicine or any healthcare. If someone isn't helping you, get a second opinion, find someone else, and realise that not everyone is going to be able to help you. But there are that can.
The problem is, I think, that our bodies are so resilient, and we can just soldier on. Especially women are very strong, and not that men aren't strong.
No,
men are incredibly strong.
But
lots of women just soldier on, right? And they just think, I'll just put up with this. And you wouldn't with your car, right? Just because you had a bad experience with a mechanic in your car, you wouldn't just go, right, all mechanics are bad. I'm just going to let my car rust out and die.
That's
and take
true.
it to a different mechanic. But we don't do that with our bodies. Sometimes we just go, oh, well, that doctor was terrible, doctors can't help me, or that practitioner was bad, or that didn't help me. And sometimes it's not even the practitioner that wasn't bad. I've got patients that don't take their herbs and then they blame the herbs didn't work. And I'm like, well, you didn't take them.
And that was a big thing that I did something on a post on recently and did some awareness on, is that some people are actually self-sabotaging themselves. And they will come in and you'll go, are you still, I'm still in pain and blah, blah, blah. And I'll go, did you take your medicines? No. Did you go to the pelvic floor physio? No. Did you go and do everything you're meant to? No. And then you're like, well, how are you meant to get better? You have to be proactive. No one's going to do this for you. You've got to be part of your own healthcare as well. And it's about doing it. So if the doctor tells you to do something, or the Chinese medicine practitioner tells you to do something, then you do it. And then if that isn't working, then you come back and say,
let's have a chat now.
Let's have a chat then. But most people that aren't getting results with something, it's a compliance thing. That's a big issue too.
And something I find in our profession, the Chinese medicine profession, is especially like as new practitioners that are just starting out, they don't know how long often to tell you to come in for.
No.
And so it's not necessarily that the acupuncture didn't work or the herbs didn't work or they weren't going to work or it wasn't going to work. It's that the dose wasn't right, like as in you didn't have enough treatments. You can't just have one acupuncture treatment, have endometriosis for like 10 years and expect it to just magically disappear in one treatment. But some patients don't understand that, but also practitioners aren't telling their patients, like, you need to do this 2 or 3 times a week or 5 times a week or 1 time a week or whatever, however many times it is.
That's it.
That's a big thing with acupuncture. It's a dose issue and it's cumulative. Like the more treatments you have, often gets, especially for treating pain, we see that, you might not have any result for a few treatments and then after a 3 or 4, then it tends to kick in. Now, if patients just disappeared off after the 3 or 4, they might not get the benefit of the first 2 anyway.
I think that's the problem with probably some of the last generation too, because we've got a lot of pain medications that come onto the market where you take this pain medication and my pain goes away instantly. But it's not like that. It's masking something as well. And everything, especially to do with gynecology, I say it doesn't matter whether you're using hormones, Chinese herbal medicines, it will take months. And the longer that you've had a disease, the longer it's going to take. And it is about being compliant. And I always say to people when they come and they go, I just want to come and you fix me. And I say, look, my name's not Jesus, I don't walk on water. You're going to need a series of treatments and you've got to be real about this. You've had a disease for 10 years. It's going to take you, it could take you a year before you even get to a point. Right. Not saying that you can't get the results very quickly, after a few treatments, but to get fully better, it might take 12 months.
You might see improvement along the way, but it's not going to be that wonder fix. And I really like what you said about that integrative approach, because I think that might be the key of some people. They've done one thing, they did the laparoscopic surgery, let's say, but then they didn't do anything else after that. Or they've done some medication and then, or some have done some herbs or acupuncture, but they didn't do the pelvic floor. And so sometimes those things in combination together is the key, right? Rather than just the one thing.
It is the key for endometriosis especially. And as I say, we know that despite the best surgical intervention, I said, women are still in pain and still have symptoms. And a lot of them I'm seeing are just trying the medical model only. And not saying that you shouldn't, you should access that, but they're not accessing the rest of it to have that multimodality team approach. There's even research now, every Endo March they promote yoga and stuff as well, because there's been some research showing with women do yoga, they feel better.
That would help with circulation, like from a Chinese medicine perspective, moving, because it's very much about stretching the channels and moving, the channels and your muscular pathways basically, and removing toxins and stuff that are stuck in those areas, right?
That's right. And now we've shown that things like yoga can relax you, mindfulness, meditation, qigong, tai chi. There's even an app now called the Curable App, which is they've shown that if women consistently use the Curable App, that because it's working on mindfulness and helping with pain. From this aspect, that they can have a reduction up to 40% in their pain just by calming down the system.
And I think that's something that with any kind of period pain, like let's say if you've got period pain as part of endometriosis or you just got period pain, it's coming, like you're tracking that period, and unless you're one of those women that has the surprise period that doesn't know, they don't track. I've got some patients like that, like, I don't know, I don't track it, it's like a surprise. Every month. It's like, well, that's a great laugh. Anyway, like they know it's coming, so they're preempting that pain anyway. And I'm not saying it's in your mind at all, but part of it is like, there's stuff in psychology about pain and illness behaviour, and the way, like, when you have, like, different cultures behave differently with different illnesses because of the way they're conditioned by society to behave. And it might not be society as in the Australian society or the UK society, but like your family might react to pain in a particular way, and so people have a particular reaction. And then once you start treatment, and the treatment might be helping you might still be stuck in a psychological, I don't know, like a loop that's you're still in that, right?
You can. They've shown that some people we know that they're physically, their pain's being taken away or the cause of their pain's taken away, but they're still in pain. And it's because the brain hasn't caught up that an area's been fixed.
Yep.
So it's not saying it's in their mind, but it is in their mind, because the brain then has to be rewired to go, hey, you're not in pain anymore, and you've got to get the brain to recognise, okay, the pain's gone. And then once you do that, the pain goes.
Yep, yeah. And likewise, that's how these mindfulness techniques can take away pain when we haven't treated the cause of the pain and the psychological effect of those things.
This is it.
Yeah.
So it's about, again, trying that team approach and realising that we have to look at everything now, not just one model.
Right.
We need the medical model, definitely, but we need other therapies to work alongside of it, and that's how you get the best results for women. And you see the women that do, that are doing that multimodality approach, they are way ahead of anyone else.
Yeah, right. Okay. So if you're watching this and you're one of those things that people think, oh, because I have some patients like, I just want to be natural. I just want to do all natural. Then like maybe take heed of this message, and you're not doing yourself a disservice by using some of the things that Western medicine has to offer.
No.
If you're interested in doing that multimodality approach and you want to be guided, like which way to go next or these kinds of different things, then definitely hit up Andrew's website, the link that we'll put below, because he can kind of help guide you
and I can look at it.
Consult with people, right, to do that.
That's right, and because of the having had the medical training in the Western side of things for reproductive medicine and women's health medicine, and then also having the complementary medicine background, I can look at it from both angles and go, okay, this is what you need, this is what you need in each one, and every medicine has something to give us. But we all have our limitations, like Chinese medicine doesn't do surgery. But then, Western like surgery doesn't do internal medicine. So it's about working together, and if we all work together for these women, we can give them some incredible results and also get their life back.
Yeah, awesome. Yeah, because it's a lifestyle thing, and it doesn't just affect people the few days they've got their cycle.
No,
it could affect you the whole cycle round, right? There can be all different symptoms at different parts of the cycle, and it can be really debilitating.
Yeah, and this is why they're saying to women, period pain is not normal. It's not. You're not meant to get period pain, and if you do have period pain, you should seek help. But at the same time, with endometriosis, we want people to know it's not just period pain, it's bloating. Like some women we call endobelly, they look like they're 9 months pregnant.
Right.
And that could come up at any time, and they're blaming foods and all kinds of stuff, but it's not food, it's just pure inflammation.
Wow, right.
And then they could have the psychological aspect, the mood swings, they could have migraines, pain on bowel movement, irritable bowel, alternating bowel movements, irregular bleeding, pain with intercourse, the whole lot.
Yeah, okay. All right, awesome. Well, this has been so informative, and I think that our viewers and listeners are going to love this content, and so thank you so much for sharing your knowledge.
No, it's my pleasure.
Yeah, awesome. So if you're a practitioner and you'd like to know more about Andrew's groups and his integrative approach, then you can check out his website. If you're a patient, you'd like to do consultations with Andrew with his integrative approach, then you can check out his website.
and get behind Endometriosis Australia. It's got Endometriosis March, and they have high teas and things like that to support, and they do a lot of work at government level, so support them too. You can go along to the high teas.
Awesome. Yeah, that's a good way. Get a high tea and learn about endometriosis, and and you can support those initiatives to generate more interest and raise funds for that as well.
Yeah.
Awesome. All right. Well, so don't forget to subscribe to the channel if you're new here and you like this content. You can then, if you're on YouTube, click the button below, the little subscribe, the little bell, and that way you'll never miss a video when we publish something out. And if you've got a comment, you've got a question or a concern or something like that, and you want to pop that in the comments below, I'll attempt to answer your question. And I love hearing people's questions and comments. If this is something that's resonated with you, pop that comment below. And if you're on Apple or iTunes, don't forget to leave us a review on there if you love listening to the audio. That really helps us because we're new on those platforms. So if you're on Spotify or something like that and you're listening, then leave us a review on there, and that really helps us. So thank you very much, and we'll see you again on the next episode.